So, while our theme this year is One Health in Action, Ending Inequalities to Achieve Global Health, I'd like to formally open the first session of the day, which is on interdisciplinarity in One Health implementation from social sciences to artificial intelligence. Now, clearly this is quite the broad topic, but it's in the thought of integrating everything together, both the things that we might have left behind or obscured previously, and new and emerging technologies that we can bring into the fold to help us achieve global health. Our first speaker of the day, our keynote speaker, is joining us now virtually. So without any further ado, from the World Health Organization, please join me in welcoming Jorge, Matheu, Alvarez.
Thank you very much. Good morning, everyone. Can you hear me and see my screen? Yes, I am seeing that the screen is there. So I hope that you are hearing me. Thank you for this invitation. This is a great opportunity to promote the One Health activities focusing on antimicrobial resistance. So I'm here on behalf of my colleagues in the different quadripartite organization. It's important to mention this here because when we talk about One Health, we cannot just talk about one sector. So you know that we are working together to promote all this work together and also show that it's important to include this multi-sectoral work and support countries in the implementation of national action. What I'm going to share this morning is some tools that we have developed and are almost ready to support implementation in countries. And the first is the WHO Medical Important Antimicrobial List, the One Health Integrated Surveillance Guidance, the One Health Priority Research Agenda on AMR, and the Quadripartite One Health Legislative Assessment Tool. But let's go to the definition of One Health. This is important. This was developed by the One Health High-Level Panel in 2021, and is saying that One Health is an integrated, unifying approach. It recognizes the health of human, animals, plants, and the environment are closely linked and interdependent. So from here, we need to understand that we need to work together, and then this approach mobilizes multiple sectors, disciplines, and communities to work together. And this is one of the things that we need to promote more, how we can work together, how we can establish this collaboration in countries to address these One Health issues that we are experiencing now. And this is to support and contributing to sustainable development. So this definition is important to promote because we need to work in the different disciplines and understand how we are connected between the different sectors. Then to coordinate all this work on antimicrobial resistance in 2019 was established this. First was the Tripartite Joint Secretariat, and then the United Nations Environment Program was joined in 2022, and now is the Quadripartite Joint Secretariat. And basically, this quadripartite initiative is supporting the global promotion, advocacy, and political engagement, the global governance structures in countries, coordination monitoring of the quadripartite strategic plan and work plans, and support the implementation of tools and guidance in the member states. All this work that I'm going to share today are funded in different global documents. The Global Action Plan on AMR launched in 2015, the Interagency Coordinating Group report that was launched in 2019, and this report is the result of the United Nations General Assembly in 2016, and with different recommendations that we are addressing, developing these tools to support countries, the implementation of national action plan. We also have the Quadripartite Strategic Framework that was launched in 2022, And last but not least, the One Health Joint Plan of Action, launched in 2022, which one of the action tracks is on antimicrobial resistance. And you can see on the right side the documents that I'm going to share today to you. But let's see what is the problem on antimicrobial resistance. We need to use antimicrobials in the different sectors, but the overuse and misuse has created and developed this antimicrobial resistance. That is the problem that we have now. So it's a complex problem because you can see that is the use in different sectors, but subsectors and also impacting the environment. So what we are developing in the quadripartite is some tools to address the different aspects of this complex problem. First, the responsible use of antimicrobials. Second, to provide more evidence through surveillance. So we need to strengthen these activities in countries, to also conduct research, and I will talk later about this, to improve research mainly in low and middle income countries, because it's where we don't have enough evidence what is happening in the context of low and middle income countries. And last but not least, legislation. If we are going to implement all this technical work to address and understand more the problem at a local level, we also need to strengthen the legislation to have a better sustainability of the different actions on the implementation of national action plans. Let's see the picture of the status of the implementation of national action plan. This is a tool that you can find in this website that you can find in the bottom left side with different questions. It's a self-assessment survey for countries to answer what is the status of the different activities to implement the national action plan. But here, I'm just referring the multi-sectoral coordination mechanism on One Health AMR. And this is the result on the report on 2023. The 2024 will be launched in the coming weeks. But you can see that at least most of the countries has established this multi-sectoral working group with the government leadership. So in this, you can see the different stages from A, which is no formal multi-sectoral governance, to E, what is the ideal status that we need for countries to establish. So you can see that most of the countries are in the stage B, and most of the countries that are in the stage E, most of them are high-income countries. That's one of the why we are focused more in low and middle-income countries, where they need to increase capacities. Let's move to the WHO American Important Antimicrobial List. This was previously known as the WHO Critical Important Antimicrobial List, the CIL list. And this list is supporting the Objective 4 of the Global Action Plan on Antimicrobial Resistance to optimize the use of antimicrobial medicines in human and animal health. This is not new. It's a journey of 19 years. The first revision was published in 2005, and basically it's a ranking of medically important antimicrobials for risk management of AMR due to non-human use. And this is highlighting what is the antimicrobials that are critical to treat severe diseases in human health. And if some of the antimicrobials are used in other sectors, they need to take care of the use of this antimicrobial, because resistance can be developed and this resistance can be transmitted to the human health. So that's why this ranking is guiding countries to be careful and better manage the antimicrobials, mainly those medically important antimicrobials. We have 3 categories I will explain later: critical important, and from here, the highest priority critical important antimicrobials, highly important, and important. The last report was launched in February this year. And some context here is that we know that we have common bacteria in the different sectors. And also we use antimicrobials in different sectors. One of the issues that we have found in some countries is that who are using the antimicrobial think that the antimicrobials are different, the ones to use in humans and those to use in animals. But at the end, they are the same class, they have the same action, and of course, if the resistance is developed, it's going to affect both antimicrobials. That's why these antimicrobials with common action, we need to take care on the use in the different sectors. This is examples, for example, on quinolones, when in humans we use usually ciprofloxacin, and animals enrofloxacin, but they are the same class of fluoroquinolones. The same with cephalosporins and amphenicols. And also, we have the pathogens that in the last WHO bacteria priority pathogens, we have Salmonella and Staph aureus, who are considered as in the high group. And then we have E. coli, which is considered one of the species in the critical group. So we need to also consider this, that we, when we are going to apply and use antimicrobials in different sectors. What is the purpose of this list? To ensure that all antimicrobials, especially these medically important, are used prudently in all sectors. And also to help regulators and stakeholders know which antimicrobial use in animals present higher risk to humans. The target audience is national regulators, policymakers, all professionals prescribing antimicrobials, the new national AMR steering or coordinating committees that has been established in each country to support the implementation of the National Action Plan, and of course, food animal producers, institutional food purchasers, and food companies. In summary, we analyze all classes of antimicrobials, and we categorize in the different groups that I will explain later. All antimicrobial classes were evaluated based on the authorization status in the different countries. So we need to consider all the authorization status in all countries and where they are authorized in humans, both in humans and animals, or only in animals. Another thing that is important to mention is that this categorization is based on resistant mechanism. So we are analyzing classes, not agent by agent. We have some antimicrobial that have different resistant mechanism that we explained in the document. So from this, we have three groups. The first group, we define the antimicrobial that are only used in humans. Then we have the group of classes of antimicrobial that are used in both in animals, in humans, and also in plants. For this specific group, we need to apply some criteria and prioritization factors to have a better categorization. And then we have the highest priority critical important antimicrobials, the critical important antimicrobials, the highly important and important antimicrobials. And the third group is those classes of antimicrobials that are only used in animals. So for the first two groups, the ones used only in humans and the classes of antimicrobials who use in animals and humans, we consider these as a medically important antimicrobials. And you can see that, of course, we need to preserve the antimicrobial use in humans. And that's why, because it represent a high risk on development of AMR. This is the result of this classification. I'm just showing here the classes included in the highest priority critical important and the critical important antimicrobials. From the last revision in 2018, we keep cephalosporins, third and fourth generation, quinolones and fluoroquinolones, and polymyxins that basically colistin and polymyxin B. And now we move macrolides to the critical important antimicrobials because it's not so critical in human health. And glycopeptides were moved to the antimicrobials that are only used in humans. And the critical antimicrobial, critical important antimicrobials, we have aminoglycosides and ansamycin. And the other groups were moved to the classes only used in humans. What is the intended uses for these antimicrobials? The prioritization of risk management strategies, to be used in developing policies and guidelines to guide approaches to reduce or restrict the use of antimicrobials in non-human sectors. For example, the elimination of use of these antimicrobials for non-veterinary medical purposes, for example, growth promotion, the inclusion of these antimicrobials in AMR, AMU monitoring and surveillance programs, and communication on risk. This is the situation of laws in countries where prohibit the use of antibiotics for growth promotion. And we see that also in the report by the World Organization for Animal Health this year, there are 24 countries that are still reporting the use of antimicrobials in most important, the highest priority critical important for growth promotion. So this is really critical that we need to work more with these countries to eliminate the use of these medical important antimicrobials for growth promotion. It's not the purpose for treatment. So that's why we need to remove this and preserve for human health. Let's move to the One Health integrated surveillance of AMR. This is the status of countries establishing or implementing integrated surveillance of AMR. And also, I would like to share what the different organizations are doing based on the mandate. So WHO we established in 2015 GLASS, which is the Global Antimicrobial Surveillance System focused on the human health. The World Organization for Animal Health is collecting data on use of antimicrobials in the animal health in the different countries. And FAO is also working on the collect data on AMR in animals and food, and also data on use in plant and production and protection. They launched this year the International FAO Antimicrobial System Monitoring System, which is called INFARM, to promote the implementation of this AMR system in animals in the different countries. But we have some examples here that we really want to promote to increase the interest in countries to establish this multi-sectoral integrated surveillance system. This is from DATMAP, from the Danish Integrated Antimicrobial Resistance, when they demonstrated when they reduced the use of macrolides in pigs, the resistance also drops. So this is a good example. We have also from the report of the JACRA report from the European Union, how it's related the consumption of fluoroquinolones in food-producing animals and the probability of resistance. So they are directly related. So when we use, we are going to have more resistance. And the last, this good example from Canada on Salmonella Heidelberg, an E. coli and Salmonella in human and animals. So they have high resistance in 2004 when they established this measure to reduce the use of third-generation cephalosporins, and we can see how the resistance also drops. So this is exactly what surveillance is providing to countries, how they can monitor what is the status of resistance and how they can apply interventions to reduce and contain resistance and transmission to the different sectors. So now we are working in the new quadripartite guidance on One Health integrated surveillance. We have also included some tools that have been developed and published WHO, the IGSR integrated surveillance of AMR in foodborne bacteria. The ESBL tricycle protocol, that is the One Health model that WHO developed in 2021. The Codex Standards on AMR as well, 3 different documents on risk analysis, the code of practice, and also integrated surveillance, and also the World Organization for Animal Health, the terrestrial and aquatic codes. From this, we are developing the first quadripartite guidance on One Health integrated surveillance. Additional to that, we are also promoting a new platform. The name is GISA, which collect the information from countries from the different aspect AMR and AMU in the different sectors to facilitate the visualization of results in each country and also to promote this integrated surveillance. Moving to the One Health research agenda, This was a global exercise supported by the quadripartite and is focused on AMR at the interfaces among One Health sector. This is important because it's only cover interfaces. Each organization is developing their own agenda. In fact, WHO already developed the agenda for the human health and launched this year. The aim of this One Health priority research agenda is to identify and prioritize research areas at the interface between One Health sectors, catalyze interest among researchers and donors on One Health AMR, and provide direction for investment in One Health AMR, and especially focus on low and middle income countries. What is out of the scope? Research and development of new antibiotics or antimicrobials and vaccines, diagnostic development, research related to only one sector, as I explained before. The objectives is to improve our understanding of transmission of AMR drivers and impact, and mainly in the context of low and middle income countries, strengthen the evidence base for interventions, and advocate for prioritization of AMR mitigation and inform policy making. We focus in 5 pillars: transmission, integrated surveillance, interventions, behavioral insight and change, and economics and policy. And I fully agree with Colombine, who mentioned that we also need to consider the social sciences here, and that's why it's one of the pillars. We need to move from the basic science to see what is the behaviors that also drive some resistance, and also to provide some evidence to promote intervention on these aspects. So finally, we have 62 priority research areas that in the 5 pillars, and you can find this in the report. We have the top 10, which is the first 2 of the top 2 of each of the pillars. And on transmission, the impact of infection prevention control practices on the development and circulation of AMR in the different sectors, the impact of transmission across human, animals, and plants, and the environment, with focus on low and middle income countries, and integrated surveillance, optimum strategies and minimum standards and laboratory capacity. We know that one of the main challenges in countries is to increase this capacity of laboratory, which is key for surveillance. How we can integrate existing AMR and AMU data from the different sectors and allow early identification of development and circulation of AMR across the sectors. On intervention, what is the impactful intervention for AMR control that can be applied in different contexts? Existing challenges to the systematic collection analysis of data for risk assessment and intervention, focus on low and middle income countries, behavioral insight and change, social sciences, identifying, characterizing, and assessing structural challenges and barriers to AMR behaviors. And we know that this is really case by case, country by country, so we need to explore and have more evidence on this as well. And also strategies to adapt behavioral interventions to different contexts. And last, on economics and policy, what is the optimal socio-economic impact assessment in low and middle income countries based on cost-effectively collected data? What is government cross-cutting actions for policy option and sustainable financing strategies? We have some infographic that you can find in the website, and also to help you to identify some opportunities to conduct research on One Health AMR. Last, the quadripartite One Health legislative assessment tool. So if we see the problem, also lawyers need to understand where is the legislation for this of the sectors, subsectors, and how this legislation can be improved, how AMR can be included in the national legislation to improve governance and also application and sustainability of the action to contain AMR. This tool was developed based on FAO methodology to analyze AMR relevant legislation in the food and agriculture that was developed from 2015 to 2023 and was applied in 34 countries for the 4 continents and 3 regional organizations, 5 regional workshops, around 45 countries. But countries also were asking about a One Health approach, how to involve other sectors in this legislative tool. So that's why the quadripartite developed this with the objective to assess national legislation relevant for AMR, to identify gaps and opportunities for reform, facilitate an understanding of the sector-specific needs of each legal area related to AMR, contribute to AMR governance, arrangement to promote One Health approach, and this is not a guidance document. It's also an assessment tool to identify these gaps, will help countries to address AMR in legislation, in the national legislation. So the process we start in 2020, and the document will be published in the coming months. We pilot this in 3 countries, in Cambodia, Morocco, and Zimbabwe, in Peru as well, but only the human health chapter. We also conducted 2 multi-country workshops in Latin America and the Caribbean, and also in Africa. And we launched this in November 2023, but the document will be launched and published in the coming weeks. The chapters of this legislative assessment tool include the institutional framework, human health, food safety, veterinary legislation, pesticides, plant health, and environment. These are some of the questions that you can find for each of the chapters, but each chapters contain different questions to address and identify these gaps. What we are doing now is promoting this with different groups. That's why thank you for this opportunity, because we need more support to conduct and implement all these tools and instruments to support countries in the implementation, to identify what is the evidence needed to intervene. So we are also targeting donors, experts, scientific community at the different levels, at global, regional, and national level. We are also working with the interdisciplinary multisectoral research networks, collaborating and reference centers, supporting the quadripartite organization, scientific and research community. You can find all these documents and tools in this website that I am sharing in the bottom left side. This is the last. Thank you very much again. You can also contact us. This is the different colleagues working in different instruments and tools. Thank you, and I wish you an excellent day.
Thank you, Dr. Alvarez. Now, carrying on from that, do we have any questions in the room? We'll open it up. Just raise your hand and we'll bring around a microphone to you. Yeah, over on the left.
Hi, my name is Daniela. I'm a veterinarian from Colombia. I've been living in a small village in a rural area, and I've seen that a lot of people, of course, that are not veterinarians and that don't even have any degree are able to sell antibiotics, and they use it very, how would you say, they use it for everything. So how do you have an example of how to tackle that? Because I found it very hard to explain people that you cannot use them like that, and it's such an embedded question that you really can't approach to them in how you would speak to your colleagues, for example.
Thank you. This is an excellent question, and I couldn't include all the activities that we are conducting, but here there are 2 aspects that I would like to highlight. One is that the first strategic objective of the Global Action Plan is on awareness and education. So there are a lot of initiatives now to conduct better awareness for the different prescribers in this case. But another thing that is important is that we are working directly with the countries to implement the Global Action Plan. So these national action plans are based on the Global Action Plan. So they also need to address more campaigns, awareness campaigns, but also this is important to understand why they are doing that. And that's why, again, the social sciences, the behavioral insights will be important to address. We are just starting this work. It's a lot of work to do, but we are identifying where is the gaps, when we need to apply. And again, I agree with you, it's a big problem, but we need to identify what is the aspect in my country that I can support. For example, some studies about why they are using that. They need guidance. Is more to improve legislation. We need more evidence about the resistance and the use of this freely use of antimicrobials in the animal sector. And also, the World Organization for Animal Health is developing also awareness campaigns. They have very good tools that you can also check in the website to understand, but also to contribute and address this issue that we have in many countries. This issue is not only in Colombia, it's in many, many countries. So that's why we are promoting global initiatives and strategies to address. Thank you.
Thank you.
Any further questions from the room? Yes, yeah.
Thank you for your presentation. Most of the molecules that you mentioned are actually antibiotics. Do you have similar strategies for parasites, antiparasitic molecules, for example?
Thank you. This is also a good question. Yes, it's true. And in fact, the idea of, for example, the medical important antimicrobials, and when we call in this list, is only referring to antibacterials. What we are doing now is to address antifungals. That is also a big problem here. On parasites, we are working with the One Health group because it's, the aspect of antiparasites is in some ways a different world, let's say that. And it's something that we still need to work, but it's not, how to say this, it's something that we now are more focused on bacteria because it's the high burden of diseases and also the problem that we have. So yes, we are going to cover, it's not in the coming years because we are more focused on AMR, antibiotics, sorry, antibacterial resistant, but we are also seeing to recognize what is the problem and see how we are going to address also a global level. Thank you.
And if we have a brief question, yeah, down here. Yeah.
Mark Lientry, Université Paris-Saclay. Thanks a lot for your presentation. Most of the measures you presented are, how could I say, based on the demand side of antibiotics. What about the supply side? Do you have any levers that you could pull to try and act directly with the pharmaceutical industry to get them to maybe reduce both their production and their aggressive marketing to sell antibiotics?
Yes, we also have, but this is more sector specific. In the case of the human health sector, we are not only trying to address the issue of new molecules, but also how we are going to work together with the industry. Not, the problem is not the overuse, it's also the access of antimicrobials, and not only antimicrobials, also diagnostics. But in the case of access of antimicrobials, we see that there are some molecules that are freely, as mentioned for the colleague from Colombia. In some countries, they don't have the access to the most important antimicrobial. So it's both things. We are covering this in the human health first, we are developing operational guidance for countries to address first the evidence of the use of antimicrobial, but also how to improve the access of the essential antimicrobials by sector. The World Organization for Animal Health is also conducting some work on this, but it's again, I'm just mentioning some of the work that we are conducting, but there are different initiatives that we are doing, and one of the to improve the access and responsible use from the industry to a market to the countries is another activity that we are also conducting. Thank you.
With that, we'll bring that session to a close. And please join me in thanking Dr. Alvarez.
Thank you very much.